bring you this now. The National Education, Health and Allied Workers Union says healthcare workers in Gauteng are struggling to treat the increasing numbers of COVID-19 patients within the province. Now, the union is pleading with government to provide additional resources to healthcare facilities. But Gauteng is expected to see a surge in new infections as holidaymakers return. So to discuss this even further, I'm joined now by NEHAWU's Clement Marule. Mr. Marule, thank you for your time. A warm good morning to you. What are some of the conditions with which your members and the healthcare workers are working under currently, particularly during this second wave?
Morning, and thank you for inviting us. Yes, indeed, we have since made a comment that we are already starting to feel the pressure from our, strategic hospitals in the province. We started doing the assessment as early as mid-December 2020 until the 4th, which is Monday, on January 4th of January, which was Monday, doing some assessment there. So the SNAP assessment is that we are getting reports that the majority or most of our frontline workers or healthcare workers in general in these strategic hospitals are getting, infected. So there are a number of reported cases in these strategic hospitals. And so it's a concern to us that this happens at a time when people are coming back to the province. The holiday makers and so on are coming back into the province. So it is a concern really for us, the state of affairs.
Right. So with the state with which healthcare workers are working under right now, where even some of the members and workers are themselves getting infected, I mean, in terms of hospital capacity, is there enough capacity to deal with the influx of patients at this rate in Gauteng specifically?
We are not yet briefed. Yesterday we were supposed to have a briefing by the Gauteng Command Center, and I'm told that it was postponed. But we are having a scheduled meeting with the new appointed MEC of Health on Monday, where we'll be, taken through as to the state of readiness insofar as personnel, insofar as the beds, and so on. So we. At this point, we are not at a position where we can say confidently that there are, sufficient beds and so on. But we're looking forward to that briefing with the MEC of Health on Monday, where she'll be taking us through insofar as the state of readiness by the department.
Yeah, Mr. Marule, I can imagine, though, this is a concern, because while you wait for that briefing, and I'm quoting you here, saying that in an article that you are actually expecting the situation to get worse. So meaning that you would appreciate a sense of urgency from government in as far as resources are concerned, in as far as ensuring that healthcare workers are protected and are safe and are provided with that PPE. How severe do you think this situation can be should it not be addressed with a sense of urgency?
Yeah, indeed, the situation is going to be dire, really, if the department is not going to be moving with speed. But we are comforted that already such a meeting has been scheduled. In fact, it was supposed to happen today. So because of the absence of the HOD of health, so we had to reschedule it to Monday. But really, the situation is really gradually getting out of hand. If you can imagine, if in a hospital like Dr. Mukari, we're reporting 83 almost of healthcare workers, which is inclusive of nurses and so on, were to be, positive. And in Chris Hani Baragwanath, in one ward, for example, Ward 20 and 35, 19 of these healthcare workers, which is inclusive of nurses as well, were to be reported positive. It's a situation that you can't take lightly. So the situation is very much urgent.
All right, Mr. Marule, as you've mentioned, we'll await the outcome of that meeting and be sure to keep our viewers updated. Thank you so much, Mr. Clement Marule.